It's not like I didn't tell you this one was going to be long. Part 6. So talking about ovarian cancer and genetics. So this is where the BRCA gene comes back. Again, with that specific mutation, there are some women that have to have the conversation with their gynecologist, with an oncologist, that if they have that specific mutation, prophylactically, meaning removing before they ever have a symptom, before they ever have a sign of cancer, removing their ovaries in some cases is considered. Also, there are some types of genetic mutations that cause colon tumors and colon polyps that have an increased risk of having ovarian tumors. That's just another genetic link as well. But I wanted to make that point specifically about the BRCA gene here because it can hit women, unfortunately, both with breast cancer and ovarian cancer. And just thinking about prophylactic surgery is something hard to swallow. So signs and symptoms, and I've mentioned this before, they're unfortunately all vague. And it stands to reason because if you think about your abdomen, if you have, constipation, you're not going to just jump to say, I have ovarian cancer. Or if I'm having, I felt bloated a lot the past couple of weeks, you're not going to jump to ovarian cancer. You're going to think about things related to the GI system. And so all the things here that you tend to have when you get local effects, it doesn't happen until the tumor's big, unfortunately, because you need a lot of compression on the GI system. And then when you do get symptoms, it's easy and you're going to jump to putting them onto problems with the GI system. So I'm not going to read everything off here, but it's not until you either had the symptoms for a while and you get worked up that it's going to get pinned down to the problem being with an ovarian tumor. This is hard to diagnose. So on the incidence, prevalence, mortality end, note that on the link that I gave you, it's not a top 10 cancer per year on incidence, but it is a top 10 cancer per year on deaths. That's not good. So about 1 in 78 women will get ovarian cancer in their lifetime. For 2020, and this is about the best number I could find, the American Cancer Society predicts about 21,000 new cases. In 2016, about 6.8 out of 100,000 women died from this cancer. So about 14,000 plus women died out of 164 million. 6th place on the cancer deaths list. So you're not on the top 10 list for new cases, but you are in the top 10 for mortality. That's not the ratio you want. So screening, and this is why it's bad. There's not a screening program. And it's not because one's not wanted, one is wanted. There is a tumor marker called CA125, and it is a marker on ovarian cancer, but it is a marker on other things. So it is not reliable to use as an early detection method for ovarian cancer. There's a ultrasound test called Transvaginal Ultrasound, but instead of having the ultrasound being on the outside of the abdomen, it's done, transvaginally. And so it's rather invasive, and it's not something that's easy to do in the office. And so the transvaginal ultrasound is much better at picking up other tumors and masses, but it's not great for picking up ovarian cancer at an early stage. So between no good blood test, no good early and cheap and easy to do radiology test, there's no screening method, especially for somebody at average low risk. So that means it's hard to find cases early, and especially with the symptoms, there's nothing that's pointed to. So survival, only about 20 cases are found at the early local stage. This leads to the high fatality rate. The overall 5-year survival rate is 48%. And I put a link in there for you. Now, again, like breast cancer, subtype matters and matters a lot. And I will pick up here for for part 7